Good evening. Joining me are Major General Tim Gowan of the Maryland National Guard and Dr. Jinlene Chan, Deputy Secretary at the Maryland Department of Health. We begin 2021 at a critical moment in the war against COVID-19, which continues to pose a serious threat to our state and our nation. While the initial launch of vaccine distributions does offer us a glimmer of hope, we still have a long way to go in this fight. Distributing and administering vaccines throughout 2021 will be, without question, the greatest peacetime undertaking in American history. And it will be a massive, all-hands-on-deck, ongoing operation involving the federal, state, and local governments and the private sector. Over the last nearly 3 weeks, we have already successfully allocated, deployed, and distributed 270,150 doses of vaccines directly into the hands of our frontline vaccinators at hospitals, nursing homes, and local health departments to begin Phase 1A, vulnerable population vaccinations. This represents 98.7% of all the doses that the federal government allotted to the state of Maryland. Only 1.3%, 3,727 doses, have been retained by the state at the State Health Department for emergency backup reserve purposes. 270,150 doses have already been deployed to every single hospital in Maryland, to all 24 of our local health departments across the state, and to CVS and Walgreens, which have a federal contract to handle all of our nursing homes across the state, and to support the vaccination of our Maryland frontline workers at federal facilities. We've distributed them out to our Maryland frontline healthcare workers who work in both federal facilities and to those who work in facilities in D.C., Marylanders who work in hospitals in the district. 163,225 were sent to every Maryland hospital for critical frontline workers. To date, those hospitals have administered 55,941 doses, which is 34.3% of the doses which we provided them. Some of our hospitals are doing extremely well, already utilizing as much as 67% of their total allocations, while others are still just ramping up. The slowest hospital in the state has completed only 16% of their allocation. We have also deployed 35,200 doses to every one of our county health departments, and they have begun vaccinating their vaccinators, EMTs and first responders, so that they could then in turn start up their county vaccination clinics. Local health departments have already administered 11,401 doses, which is 32.4% of what we have deployed to them. 5 counties have done a remarkable job and have already completed 80% or more of their Phase 1A vaccinations. That includes Howard, Montgomery, St. Mary's, Calvert, and Caroline counties. Other counties are just beginning to ramp up their operations. 61,425 doses were sent directly to CVS and Walgreens, which have a federal contract to administer vaccines in all 227 of our nursing homes. To date, CVS and Walgreens have entered into our system data showing the completion of 8,503 doses, or just 13.8% which is actually close to on par with the numbers that they're doing nationwide. But we've been working hard to get to the bottom of all of these provider issues. So I have contacted Health and Human Services Secretary Alex Azar to express our serious concerns about the pace of the federal nursing home pharmacy program. In addition, I had long and I would say productive discussions earlier today with both the CEO of CVS, who said that they had actually done nearly twice as many vaccinations in Maryland as are being reported, that they are now working with our team to correct data reporting issues, that they had not entered the data into our system yet. I also spoke with the CEO of Walgreens, who said that they have now scheduled clinics at every single one of the nursing homes they're responsible for, that they've been assigned under the federal criteria of the ones that they've been assigned. We're going to continue to stay on top of this. We're going to be in close contact with CVS and Walgreens to continue monitoring their progress and seeing what we can do to help them continue to ramp up their vaccinations. Most of the states in America are having very similar issues with those contracts. So we have also reached out to the National Governors Association in an effort to begin some joint dialogues between all of the nation's governors, our federal partners, and between these pharmacies that are conducting those contracts. While none of us are thrilled with the pace of this rollout over the first couple of weeks, I can assure you that it is improving every day. Our numbers in Maryland are in line with the rest of the nation, and in fact, we're ahead of 27 other states. The good news is that these vaccines have arrived years ahead of schedule, and that they are ramping up much faster than they did when we were back in the spring dealing with testing, back when we led the nation. But it took us almost 9 months to go from 50 tests a day to 50,000. Today alone, Maryland reported a record 11,553 new vaccinations for a cumulative total of 76,916 vaccinations. And I'm pleased to report that as of today, second doses have already begun at Maryland hospitals. I want to assure the people of Maryland that we are going to leverage every single resource at our disposal to get more shots into more arms as quickly as we possibly can in a safe and orderly way. I'd like to just take a moment to make sure that Marylanders understand exactly how this vaccine distribution process works. Each week, the federal government informs each of the states of their allocation. After that, they open up their ordering system. The federal government has a system, it's called Tiberius. And then states are then able to place our orders directly with them as to where they should ship those doses. And we're able to then notify our providers, the frontline vaccinators, and then they can immediately begin to have their clinics ready to receive those doses and to begin vaccinating. So in these early couple of weeks, there is a little bit of a lag time. Those orders are shipped out directly to the providers, to those vaccinators, straight from the CDC through Operation Warp Speed. And that process takes about a week, can take as much as a week. But vaccine administration is the responsibility of each of those providers. For example, in Phase 1A that we're in right now, it is the federal contract with CVS and Walgreens that's responsible for our nursing homes. Maryland hospitals are the ones who are doing their own staffs and frontline health care workers in those hospitals. And our 24 county health departments are receiving their doses directly for their own health department staffs and their county's first responders. All of these providers, I can assure you, have a desire to get these vaccines into the arms of the people who need them as quickly as they possibly can. and no one is attempting to delay. All of us are doing our best to work together at all levels of government and with our private sector partners to get all of our frontline vaccinators whatever resources they need to accelerate the process and to do their jobs as effectively and efficiently as they possibly can. But today I'm announcing some additional steps which we believe will help providers get more shots into more arms even quicker in a safe and efficient manner. Last month, I reactivated the Maryland National Guard to provide support to state health officials for the distribution of COVID-19 vaccines. Beginning tomorrow, the Guard will begin to dispatch emergency vaccination support teams across the state to assist local health departments with the expansion of their vaccination capacity. Each of these emergency teams will include 14 Guard members who will actually assist with the administering of vaccines and who will also be able to help provide logistical support for vaccination clinics. Through our Maryland Responds Medical Reserve Corps, which I announced earlier, of retired and or volunteer health workers, we have already identified 700 qualified people who are ready and willing to assist local health departments and other clinics with the administering of shots, and we're sharing that information with county health departments to help enable them to expand their clinics to 7-day-a-week operations. We've also offered assistance to the Maryland Hospital Association and offered every single resource at our disposal, including additional vaccinators, logistics support, PPE, or whatever we can possibly provide to help them speed up their pace of vaccinating their workers. Slow and uneven data reporting has made it extremely difficult to determine where there are issues with vaccine administration. Certain people have said that they're doing thousands of vaccinations, but they have not. Some hospitals haven't reported any at all, even though they have done quite a bit. We're trying to fix that. We need to address these reporting lags, particularly not with some of the hospitals, but also with CVS and Walgreens. Walgreens and CVS were given 72 hours to do their reporting under their federal contract, whereas we're requiring others to do 24 hours. So I had those discussions with the CEO and president of Walgreens and CVS today. And today I am issuing an executive order which requires all providers in the state of Maryland to report data onto our system, Immunet, within 24 hours after vaccines are administered. And we will be posting this data publicly and using it to track the progress of every single provider in the state. The Maryland Department of Health is also issuing an order today which states that any facility which has not administered at least 75% of their total first dose allocation may have their future allocations reduced until they can prove their ability to meet capacity requirements. Any provider that has excess doses will be required to notify their local health department so that those doses can be reallocated to other priority populations. Effective immediately, we will be adopting a new, what I'm calling a Southwest Airlines model, a rolling vaccine allocation model. No doses should be sitting in freezers, going unused, waiting, or backing up while others are in need of more. So we're going to be adjusting the plan to say that we're going to no longer be waiting for all of the members of a particular priority group to be completed before we move on to begin that next group and the next group in line. Our message to those who are responsible for doing the vaccinations is clear. Either use the doses that you have been allocated or they will be redirected to another facility or provider where they will be used immediately. Every single week, We will be continuing to push out vaccines to our hospitals, pharmacies, local health departments, and to all the other vaccinators across the state based on need and on utilization. As soon as we move forward from this initial phase 1A, which is an extremely limited supply, we will then be able to scale up to broader vaccination clinics across the state. However, I want to make this point clear. The states are wholly reliant on the federal government and on those two vaccine producers, for the supply of vaccines. In the first 3 weeks, we and the other states, we've received 4.4%, enough vaccines for 4.4% of our population. For the foreseeable future, and unless there's an increase in production of new vaccines from those producers, or until new vaccines are approved and made available, we expect to receive about 72,000 doses per week from the federal government, which is roughly 10,000 doses per day. Now, we're all hopeful that it will increase from there, and we all expect and hope that it will, but right now those are the real numbers that we're counting on. Yesterday, we already did more than that by vaccinating 11,553 Marylanders in one day, exceeding our daily allotment. So, at the current pace of allocation from our federal partners, we would expect to have 1.8 million doses by the end of May, which would represent only 30% of our state's population. So this is going to be a long haul. Dr. Fauci said, the other day on television that we could expect to have 60% of the national population vaccinated by the fall. So that's the bad news. The good news is that this week, as I mentioned, we have already begun second doses for some. And not only that, but we have also already expanded our phase 1A populations. We are now all licensed, registered, and certified healthcare providers anywhere in the state are now eligible for vaccination. Local health departments have now begun to make arrangements with providers to get them all vaccinated in the coming days and weeks. Vaccinations will also soon be underway for all law enforcement agencies, correctional officers, and judiciary staff. But just phase 1A is more than 500,000 Marylanders. So if you look at that pyramid we have, that little tiny piece at the top is the 1A is 500,000 people. So I just urge people to be patient as you think about people are like, when am I getting it? Why isn't everybody done? It's a massive undertaking. Today, based on the recommendations of the Federal Advisory Committee on Immunization Practices, which is comprised of public health experts on the use of vaccines, we are announcing updates to our phase 1 of Maryland's statewide vaccination plan. Our new phase 1B will now include all Marylanders over the age of 75. It will also be expanded to include special needs group homes, high-risk inmates, developmentally disabled populations, continuity of government vaccinations, as well as teachers, child care, and education staff. The Maryland State Department of Education has already begun, but they're going to continue to immediately begin coordination with all of our county school systems to prepare the implementation of their plans to vaccinate this critical personnel. Overall, this revised phase 1B of our plan now includes approximately 860,000 additional Marylanders. Based on the current rate of allocation, we anticipate the state being able to move into phase 1B at the end of January. We have updated our Phase 1C to now include all Marylanders aged 65 to 74 and workers in additional critical sectors, including grocery stores, public transit, agricultural production, and manufacturing. Phase 1C now includes an additional 772,000 Marylanders. Based on the current rate, and again, we're hoping to see that exponentially increase in the months ahead, but based in the weeks and months ahead, but based on the current rate of the allocation that we're receiving from the federal government, we expect to be able to move into Phase 1C sometime in March. Our newly updated Phase 2 will now include Marylanders ages 16 to 64 who are at increased risk of COVID-19 illness due to comorbidities, as well as essential workers in critical utilities and other sectors. So Phase 2 will now include another 1.1 million Marylanders. Now, obviously, people have many questions about when they will be eligible. They have many concerns about the safety of the vaccines, and we're going to continue to try to provide as much information and answer as many questions as possible. But here are some of the ways that you can help to stay informed. First, the state will be issuing regular vaccination updates through our statewide 211 texting service. To opt in to receive these alerts, text MD Ready to 898-211 so that you can receive updates as soon as possible, as soon as new information becomes available. Second, Marylanders are encouraged to visit covidlink.maryland.gov for all available resources that we have on the state vaccination plan, along with all the safety information regarding the vaccines. And lastly, we ask everybody to be patient, as this will be a long process. Already, we are seeing instances where people are attempting to cut the line and cheat the rules and take appointments away from our frontline healthcare workers. Not only is this reprehensible behavior, but it also slows down the entire process. The more steps that our vaccinators and our providers have to put in place and add to verify the vaccine recipients, the longer that this is going to take for everyone to get their vaccines. So please exercise decency and common sense. While these vaccines do offer us a light at the end of the tunnel and allow us to look ahead to the day the pandemic will no longer disrupt our lives or prevent us from getting back to normal or seeing our loved ones or getting back to work or to school, right now we're still in the thick of this fight. Maryland's 7-day positivity rate did drop a little bit today to 9.19%, but it's still much higher than we want it to be. Our statewide case rate increased slightly today to 44.0. All 24 of our jurisdictions are still in the red zone for cases, according to the federal government. As of today, 1,771 COVID patients are hospitalized in the state. Fortunately, this is 8,300 beds below what Hopkins had projected for the beginning of January, which is great. Better treatments have clearly helped to improve our ability to fight the virus and to keep our hospitalizations stable. As of today, the percentage of new cases that lead to hospitalizations has fallen by 72% since April. The percentage of new cases that lead to death has fallen by 67% since early May. And the percentage of hospitalizations that end in death has fallen by 48% since early July. These are really encouraging numbers. We continue to utilize the alternate care sites we opened in the spring. Our critical care coordination center still continuing to transfer patients. All of our surge preparations are so that we're still ready to handle any additional surges that may happen. We are concerned about this much more contagious variant of the virus that originated in the UK. It's now, as of today, with the addition of Georgia, has been detected in 5 states and at least 33 countries so far. Our public health laboratory is testing for the variant at 5 times the national rate, or testing every single day. And luckily, we have not yet detected a case connected to it yet here in Maryland. But this is another reason why we all need to keep being vigilant while we focus on getting these vaccines ramped up and to our frontline healthcare workers and our most vulnerable. As I've said throughout this entire crisis, we are all in this together, and we will get through this together by staying Maryland strong. This time I'm going to turn it over to General Gowan to discuss a little more detail of some of the support the Guard will be providing to our counties. General.
Thank you, Governor Hogan, for your leadership throughout this challenging time. And thanks are in order for every Marylander who has come together to work so tirelessly to combat the spread of COVID-19. As most of you are aware, the Maryland National Guard has a dual mission. Our soldiers and airmen are generally seen either deploying overseas to fight America's wars or putting on the uniform here at home to provide aid during a natural disaster. Last March through July, 1,500 Maryland National Guard members were activated to combat this pandemic. During that time, our troops assisted with the processing and distribution of more than 59 million pieces of personal protective equipment, and we proudly distributed more than 1 million meals throughout the state. Our medical support teams screened and tested more than 22,000 people, including high-risk residents at 227 skilled nursing facilities. We all continue to experience immense challenges related to COVID, but the vaccine provides hope. Hope of not only slowing this virus, but defeating it. Over the last several months, I've assigned some of my best planners to support the Maryland Department of Health to help prepare for this vaccination effort. As the Governor mentioned, starting tomorrow, we will provide direct support to county health departments with mobile vaccination support teams with the mission of accelerating vaccination efforts. A Maryland National Guard mobile vaccination support team consists of 9 to 14 medical professionals. Initially, we will have close to 200 personnel organized in 14 teams. Additionally, we're providing manpower to support congregate care and long-term health facilities, and additional manpower to support county health department testing activities, call center assistance, data center analysis, and logistical support. Our military medical specialists are world-class professionals who live and work in the communities they serve. These unique capabilities are well suited and integrated when we work alongside our interagency partners and communities. This is an initial capability that we're fully prepared to execute and will continue to provide the support to the Governor as directed. I want to thank all the people of this great state for their support and generosity that you've shown to the Maryland National Guard. We are honored to support the great state by serving on the front lines in the communities where we reside and work. Your Maryland National Guard is always there, always ready. Old line. I'll be followed by Dr. Chan of the Maryland Department of Health. Thank you.
Thank you. Thank you, General Gowan. Thank you, Governor Hogan. I'm glad to be here this afternoon, this evening, to make remarks about our vaccine rollout. We're beginning the new year with hope as vaccines have started to roll out in the state, as the Governor mentioned. You know, there's a lot of work that's being involved in terms of this vaccine rollout, and there are more than 500,000 individuals who are in Phase 1A, which are comprised of the healthcare workers and the nursing home residents and first responders. Our hospitals have been administering vaccines to their staff members and again to some of their community healthcare workers and others. Our federal partners, CVS and Walgreens, has also been administering vaccines in long-term care facilities, and our local health departments have now been provided vaccines and are ramping up their vaccination efforts at the local level. As of this week, again, emphasizing that all the licensed, registered, and certified healthcare workers in the state of Maryland are now eligible for vaccination and distribution to first responders and others, including 911 specialists and correctional officers, are just beginning at the local level and will ramp up in the next few weeks. I've been speaking to a number of health officers around the state and talking about their vaccine clinics and about the work that they've been doing to stand up those clinics, training staff and others to make sure that vaccines are administered safely and effectively and efficiently. They have all been implementing the plans that have been developed over the course of many years and more specifically over the last few months. Many have started to vaccinate not only their first responders, but even other healthcare workers, and they continue to reach out to those populations. And now with appointments, that information will be more available to healthcare workers. We also want to appreciate, of course, the National Guard for standing up to support their efforts. Local health departments have been working alongside of National Guard and all of our public health and healthcare workers around the state to respond to COVID-19. So testing and contact tracing and other efforts continue, and now they are standing up a monumental vaccination effort across the state. And so it is all hands on deck, and so we very much appreciate the support of the governor as well as the National Guard and others in this effort. Over the last few weeks, we've been working very closely both with our federal as well as state partners to ensure that vaccines get to facilities in Maryland. And as the governor illustrated, it does take some time from the time that they tell us that we have a vaccine allocation to when we order it, and then when it actually gets delivered here to the state directly to a certain facility. And that's before vaccination even begins. And so over the last few weeks, our hospitals and local health departments, in implementing their plans, there's a lot that's been happening behind the scenes, including staff training and education, communications to the eligible groups, coordination with local providers, coordination with local counterparts in fire and EMS, for example. In addition, they had to set up appointment schedules and making sure that the clinics are set up securely and safely, and also with adequate room to accommodate all of our COVID-19 precautions to avoid crowding in these vaccine clinics. So all of this has been happening behind the scenes that perhaps people may not fully appreciate, but this is a lot of the logistics and the operational work that our local health departments, our hospitals, and our CVS and Walgreens partners have been doing every day for the last few weeks. So many Marylanders who are currently eligible to get vaccinated, so now we're expanding to include all healthcare providers, will be able to get a link to vaccine appointments, and including instructions for how to make those appointments, whether it's at their long-term care facility, within their hospital, or the local health department. Again, I would emphasize that the unauthorized use of these private registration links that are intended for someone else and directed towards healthcare workers, really, if someone uses it in an unauthorized way, it takes spots away from our healthcare heroes who really are at the front lines of caring for individuals, not only with COVID-19, but with so many other conditions, and that is our first most priority. Vaccines will become available to more and more Marylanders, and we are looking forward to advancing into the next phases of our plan as soon as we possibly can, again, dependent on the supply of vaccines that comes to the state. As we expand into Phase 1B populations, and as we receive more vaccine, we also do anticipate expanding the number of providers who will be able to register in our Immunet system and begin to receive vaccines themselves to vaccinate the population. So again, as we expand into 1B, 1C, and beyond, we also will be expanding the number of providers who receive vaccines. So this includes federally qualified healthcare centers, primary care centers, urgent cares, pharmacies, and other locations that people are accustomed to receiving vaccine. So I wanted to shift gears and just touch for a moment to a topic that the governor also alluded to, and that's about the UK variant. So like what I wanted to talk about was that we know that viruses generally will morph. And we've seen that even COVID has had some changes genetically over time, but those changes have not really impacted its ability to spread or other characteristics. However, in this particular instance, what we have seen is that both UK and in South Africa, I believe, have announced that they've seen some new variants that may change some of the characteristics of the way that the virus has spread. And as the governor mentioned, there are some states here in the United States that have already detected the variant here. So it is possible that because of travel, because of other means of spread, that the variant is here in Maryland, but we are staying extremely vigilant. We are working very closely with our CDC partners, and we are conducting the sequencing that is needed to be able to detect the potential variant here in Maryland. While it does appear to spread more easily, we have not